Hello everyone, welcome to Move Well, Live Well. Are you guys experiencing sciatica, pain down the back of the butt, down the thigh, back of the thigh, down into your calf? Well, if so, we're gonna show you the quickest way to get rid of sciatica fast. So join us, shall you? Okay, so we have Dr. K here. She's gonna be our subject in regards to this sciatic nerve fix. And so what a lot of folks come in, they have issues with their sciatic nerve. And typically the presentation is this, where they have pain either in the low back, going down into the glute, down the back of the thigh, back of the calf, sometimes into the foot. And along that nerve, they're having pain and discomfort. Well, what a lot of people do when they have sciatica or sciatic pain, they have a tendency to treat this side. So let's just pretend Dr. K, she doesn't have any sciatic pain or sciatic issues, but let's just pretend she has, this is her right side. Let's pretend she has a little bit of low back pain and pain going into the glute, going down to the back of the thigh and into the calf. So let's pretend she has sciatica going down this right leg. And what a lot of people do, they treat this side. They have a tendency to do some stretching in through here, do some foam rolling in here, and such. But in some cases, believe it or not, what you do is you treat the uninvolved side. So what happens in some cases is that you have sciatic pain down this right side, and this nerve becomes hyperexcited, and then the nerve on the other side is underexcited. So what you do is you treat the uninvolved side. You stimulate the nerve, the sciatic nerve, on the uninvolved side. So again, if she has pain and sciatica down this right side, you would treat the left side. So the sciatic nerve is a big nerve. It's a conglomeration of the nerves that come out the low back here, and they converge in the sciatic nerve as the sciatic nerve here, and they come out of the sciatic notch, which is, this is Dr. K's sacrum right here. Just to the side of the sacrum is the sciatic notch. There's the greater and lesser sciatic notch. I'm not going to go into all the anatomy with that, but and I'm not going to go into all the details of why this works. Just what happens is that this becomes hyperexcited, this becomes underexcited, and you need to stimulate the sciatic nerve as it comes out of the sciatic notches here. And you're going to do this, and you're going to mirror just as it is on this side. So in other words, if she's having pain and discomfort here in the glute, you're going to stimulate the sciatic nerve here on the opposite glute. See that? For about a minute or so. If she's having sciatica all the way down the back of her thigh and into her calf, you're going to stimulate all the way down, just like this. I'm doing a little bit of cross friction across this nerve. You're just going to go down here and trace the sciatic nerve as it goes down the opposite side of her leg, thigh and leg. So again, this is the symptomatic side right here. Hyperexcited, you're going to stimulate the underexcited side. Now the sciatic nerve is the biggest nerve, one of the biggest nerves in the body. It's about as thick as my, about a thumb width thickness in through here. And so you're going to do this a number of times until you get an amelioration of symptoms on the opposite side. So you're doing this here. Again, if it's just in here, if she has just pain in here in the right glute, you're just going to stimulate the left glute. If she has pain and discomfort going all the way down the thigh on the right side, you're going to trace it all the way down the thigh on this side. And then so on and so forth. Pain into the calf, you're going to go all the way down into the calf. So this treatment can take a minute or two, sometimes up to 3 to 5 minutes, but the idea is to stimulate the underexcited nerve to create this to complete this circuit. I'm not going to go into all the details of why this works, but so here you are, 3 to 5 minutes depending on your symptoms, and you'll find that you're going to get an amelioration of symptoms from the hyper-excited side. So again, that is the fastest way to get rid of sciatica pain fast, is you stimulate the opposite side to wherever it's going to. You can also do this yourself. You get yourself a tennis ball, a lacrosse ball, and you can do that yourself. You'll have to kind of like lie down on your back or do it in a chair or something like that and stimulate that sciatic nerve all the way down to where you're having symptoms. Again, the opposite side of where you're having symptoms. So, if you have any questions with this video, we thank Dr. K for joining us today and being our sciatica subject. We thank you for watching. We appreciate it. If you're new to this channel, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop to subsequent videos coming here in the near future. That way you can continue to move well and live well. Also, I know you know folks who have sciatica or experiencing sciatica symptoms. Share this with them. It's the quickest way to ameliorate those sciatica symptoms quick. And also, give us a like. Give us a thumbs up. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.